Hi, I'm Alex Thompson. I'm a researcher from Oxford, and I'm going to be talking about some work that we've been doing recently to look at the association between lipid biomarkers and risk of ALS. We know from some previous epidemiological studies that there are associations between lipid biomarkers and subsequent risk of developing ALS. There's also work that suggests there may be shared genetic risk between lipid biomarkers and ALS. We've used a large population-based cohort study, the UK Biobank, which incorporates data from over 500,000 participants aged between 40 and 70 to look at this in the UK population. In univariate analysis, we can see that there is an association between higher levels of HDL cholesterol or apolipoprotein A1 and lower risk of ALS, but no clear association for LDL cholesterol or apolipoprotein B. In Cox proportional hazards modelling, controlling for age and sex, but looking at each biomarker individually, we see an association between higher total cholesterol to HDL ratio and higher risk of ALS, but higher HDL cholesterol or apolipoprotein A1 and lower risk of ALS. In order to try and exclude anyone who is having early symptoms of ALS at the time of enrolment or is perhaps in the pre-symptomatic neurodegeneration phase of ALS, we perform the analysis also excluding anyone diagnosed within 5 years of initial sampling, which yielded very similar results. Multivariate Cox proportional hazard modelling, this time controlling for several metabolic factors in addition to age and sex, so body mass index, reported exercise, creatinine level and HbA1c, this time modelling both HDL cholesterol and LDL cholesterol together, or apolipoprotein A1 and apolipoprotein B together, we see similar findings. So higher levels of HDL cholesterol or apolipoprotein A1 are associated with lower risk of ALS. This time in models excluding those going on to develop ALS within 5 years of initial sampling, we also find significant associations between higher LDL cholesterol and higher risk of ALS, and similarly higher apolipoprotein B and higher risk of ALS, in addition to the same findings as previously for HDL and apolipoprotein A1. To summarise our findings, we find quite robust associations between higher levels of HDL cholesterol or apolipoprotein A1 and lower risk of ALS, even controlling for other metabolic factors. For total cholesterol to HDL ratio and higher levels of LDL cholesterol and higher risk of ALS, we find less consistent associations. This contributes to the idea that there may be an alteration in the pre-symptomatic metabolic landscape in those who are at subsequent risk of ALS.